Kangaroo care, also known as skin-to-skin care, involves placing a preterm or term infant on a parent's bare chest. This practice was originated in Bogota, Colombia, in the late 1970s. At that time, the mortality rate for preterm infants was alarmingly high, and the hospitals faced significant challenges, including a shortage of incubators and other medical equipment. Two pediatricians working in Bogota sought an alternative solution to improve the survival rates of these vulnerable infants. Inspired by the way marsupials carry their young, they developed a method where preterm infants were placed on their mother's chest, skin to skin, in an upright position. This practice was termed kangaroo mother care because it resembled how kangaroo joeys are carried in their mother's pouch. The infants were kept warm by their mother's body heat and were exclusively breastfed. The initial results of kangaroo care were remarkable. The practice led to a significant reduction in infant mortality rates, with a reported 70% drop in deaths among preterm babies within the first year. This success drew international attention and sparked interest in further research and adoption of the method. In the decades that followed, extensive research was conducted to validate and understand the benefits of kangaroo care. Studies confirmed that kangaroo care not only improved survival rates, but also offered numerous health benefits for both infants and parents. These benefits included better thermoregulation, enhanced breastfeeding, reduced infection rates, improved neurodevelopmental outcomes, and strengthened parent-infant bonding. In 2003, the World Health Organization officially recommended kangaroo mother care as an effective method for caring for preterm and low birth weight infants. The WHO's guidelines emphasize the importance of early, continuous, and prolonged skin-to-skin contact, along with exclusive breastfeeding. This endorsement helped to further promote the practice globally, particularly in resource-limited settings where access to advanced medical technology is limited. Today, kangaroo care is widely recognized and practiced in neonatal intensive care units around the world. It is considered a standard of care for preterm and low birth weight infants. The practice has evolved to include not only mothers, but also fathers and other caregivers, recognizing the importance of involving the entire family in the care process. Ongoing research continues to uncover additional benefits of kangaroo care. Kangaroo care offers numerous benefits for infants, particularly those born preterm or with low birth weight. Let's explore some of these key benefits. Improved thermoregulation. One of the most immediate benefits of kangaroo care is improved thermoregulation. Preterm infants, in particular, struggle to maintain a stable body temperature due to their underdeveloped skin and lack of body fat. When an infant is placed skin to skin on a parent's chest, the parent's body heat helps to regulate the infant's temperature more effectively than an incubator. This close contact ensures that the infant remains warm and reduces the risk of hypothermia. Kangaroo care has been shown to enhance breastfeeding success. The skin-to-skin contact stimulates the infant's natural feeding instincts, making it easier for them to latch on and breastfeed effectively. This practice also promotes more frequent and longer breastfeeding sessions, which are crucial for the infant's nutrition and growth. As a result, infants who receive kangaroo care tend to gain weight at a healthier rate compared to those who do not. Another significant benefit is the reduction in infection rates. The close physical contact between the parent and infant facilitates the transfer of beneficial bacteria from the parent's skin to the infant. This process helps to colonize the infant's skin and gut with healthy bacteria, which can boost their immune system and protect against infections. Additionally, the warmth and comfort provided by kangaroo care can reduce the infant's stress levels, further supporting their immune function. Kangaroo care also promotes better sleep patterns and neurodevelopmental outcomes. Infants who experience skin-to-skin contact tend to have more stable and longer periods of sleep. This is important because sleep is critical for brain development and overall growth. Moreover, the sensory stimulation provided by kangaroo care, such as the parent's heartbeat, warmth, and gentle movements, supports the infant's cognitive and motor development. Studies have shown that infants who receive kangaroo care exhibit improved neurodevelopmental outcomes, including better cognitive function, motor skills, and emotional regulation. Studies have shown that kangaroo care can stabilize heart and respiratory rates in preterm infants. This stability is crucial for their overall health and development. Kangaroo care has been associated with stable and sometimes improved oxygen saturation levels, which are vital for the infant's respiratory health. Kangaroo care is an effective non-pharmacological method for pain relief during painful procedures. The skin-to-skin contact helps soothe the infant, reducing their perception of pain. The calming effect of kangaroo care also helps reduce stress levels in infants. This reduction in stress can lead to better overall health outcomes and improved physiological stability. Kangaroo care also provides numerous benefits for the parents. One of the most profound benefits of kangaroo care is its strengthened bond between the parent and the infant. The physical closeness and skin-to-skin contact create a deep emotional connection. This bonding is crucial for the infant's emotional and psychological development and helps parents feel more connected to their baby. The act of holding their infant close can be incredibly comforting and reassuring for parents, especially in the stressful environment of the NICU. Kangaroo care can significantly boost parents' confidence in their caregiving abilities. Many parents of preterm or sick infants feel uncertain and anxious about how to care for their fragile baby. By engaging in kangaroo care, parents gain hands-on experience and learn to recognize their infant's cues and needs. This practical involvement helps them feel more competent and empowered in their role as caregivers, which can reduce feelings of helplessness and anxiety. The NICU can be an overwhelming and stressful place for parents. Kangaroo care allows parents to actively participate in their infant's care, which can alleviate some of this stress. The physical closeness and the act of nurturing their baby can have a calming effect on parents, helping to reduce anxiety and promote emotional well-being. Additionally, the positive feedback from seeing their infant respond well to kangaroo care, such as improved breathing, better sleep, and increased alertness, can further reduce parental stress and enhance their overall experience in the NICU. The emotional support from the nurses and the act of providing kangaroo care can help parents feel more involved and connected with their infant. This involvement is crucial for their emotional well-being, as it helps them feel like they are actively contributing to their baby's recovery and development. Parents often report feeling more at ease and emotionally fulfilled when holding their baby close. Kangaroo care is beneficial for both mothers and fathers. It helps mothers feel more connected to their infants, especially when they are separated due to medical reasons. For fathers, kangaroo care provides an opportunity to bond with their baby and feel more involved in their care. This practice can enhance paternal attachment and help fathers feel more confident and competent in their caregiving role. Family-centered care is a vital approach that recognizes the importance of involving the family in all aspects of their infant's care. It is based on the understanding that the family is the constant in the child's life, while healthcare providers and systems may change. By embracing family-centered care, we can create a more supportive and collaborative environment that enhances the overall experience for everyone involved. Let's begin by looking at the key principles that underpin family-centered care and how they guide our interactions with families in the NICU. Family-centered care emphasizes the importance of involving the family in all aspects of their infant's care, recognizing that the family is the constant in the child's life, while healthcare providers and systems may change. The first principle is respect and dignity. This means that healthcare providers listen to and honor the family's perspectives and choices. Families are treated with respect, and their knowledge, values, beliefs, and cultural backgrounds are incorporated into the planning and delivery of care. By respecting the family's role and expertise, we create a more supportive and collaborative environment. The second principle is information sharing. Healthcare providers communicate and share complete, unbiased information with families in affirming and useful ways. Families receive timely, accurate, and comprehensive information to participate effectively in care and decision-making. This transparency helps build trust and ensures that families are well informed about their infant's condition and care options. The third principle is participation. Families are encouraged and supported to participate in care and decision making at the level they choose. This can range from being present during medical rounds to actively participating in daily care activities. By involving families in the care process, we empower them and recognize their critical role in their infant's health and well being. The fourth principle is collaboration. Healthcare providers collaborate with families in policy and program development, implementation, and evaluation, as well as in care delivery. This partnership approach ensures that the care provided is responsive to the family's needs and preferences. Collaboration fosters a sense of shared responsibility and mutual respect between families and healthcare providers. Family-centered care practices improve health outcomes, enhance patient and family satisfaction, and efficiently use healthcare resources. By involving families in the care process, family-centered care aims to provide care that is responsive to the needs and values of patients and their families. One of the primary benefits of family-centered care is improved health outcomes for infants. When families are actively involved in their infant's care, it can lead to better physical and emotional health for the baby. Studies have shown that infants whose families participate in their care tend to have shorter hospital stays, lower rates of complications, and better long-term developmental outcomes. The presence and involvement of parents provide emotional support and stability, which are crucial for the infant's recovery and growth. Family-centered care significantly enhances family satisfaction. Families feel more valued and supported when they are respected, informed, and involved in decision-making. This positive experience can reduce the stress and anxiety associated with having a baby in the NICU. Families who feel heard and included are more likely to be satisfied with their infant's care, which can improve their overall experience and well-being. Another key benefit is better communication and partnership between families and healthcare providers. Family-centered care fosters open and honest communication, ensuring that families receive clear and comprehensive information about their infant's condition and care plan. This transparency builds trust and strengthens the partnership between families and the healthcare team. When families and providers work together collaboratively, it leads to more effective and personalized care for the infant. Let's focus on some common barriers to kangaroo care in the NICU. Despite the well-documented benefits of kangaroo care for both infants and parents, several challenges can hinder its implementation. In this section, we will explore the barriers nurses and parents often face when practicing kangaroo care. Understanding these obstacles is crucial for developing effective strategies to overcome them and ensuring that kangaroo care can be integrated into routine neonatal care. Identifying and addressing these barriers can create a more supportive environment that encourages and facilitates kangaroo care, ultimately benefiting the infants and their families. The physical design and environment of the NICU can present significant barriers to its implementation. One of the primary barriers is the lack of adequate space in the NICU. Many NICUs are designed with limited space, making it difficult to accommodate the needs of both the medical staff and the families. This can result in cramped conditions that are not conducive to kangaroo care. Parents need enough room to sit comfortably and hold their infants skin to skin for extended periods, but often the space is too restricted to allow this. Comfortable seating is essential for parents to engage in kangaroo care. However, many NICUs lack appropriate chairs or recliners that support prolonged skin-to-skin contact. Parents may find it physically challenging to maintain kangaroo care without comfortable seating, leading to shorter and less frequent sessions. Privacy is a significant concern for parents practicing kangaroo care. The open bay design of many NICUs means that multiple families share the same space, which can make parents feel exposed and uncomfortable. This lack of privacy can deter parents from engaging in kangaroo care, as they may feel self-conscious or worry about being observed by others. The NICU environment is often noisy and filled with distractions, such as alarms, conversations, and medical equipment. This constant noise can create a stressful atmosphere for infants and parents, making it difficult to relax and focus on kangaroo care. A quieter, more serene environment would be more conducive to the practice. The availability of family facilities, such as bathrooms, kitchens, and resting areas, can impact the ability of parents to stay in the NICU for extended periods. When these facilities are lacking or inadequate, parents may find it challenging to remain at their infant's bedside and engage in kangaroo care consistently. Some NICUs have strict visiting hours, which can limit the time parents can spend with their infants. These restrictions can be a significant barrier to kangaroo care, as parents need flexible access to their babies to practice skin-to-skin contact effectively. Nurses face numerous barriers when trying to implement kangaroo care in the NICU. Understanding these challenges is essential for developing strategies to overcome them and ensuring that kangaroo care can be integrated into routine neonatal care. One of the primary barriers is nurses' lack of training and confidence. Many nurses may not have received adequate training on safely and effectively performing kangaroo care. This lack of knowledge can lead to uncertainty and hesitation, making nurses less likely to encourage and facilitate kangaroo care. To address this, it's crucial to provide comprehensive training programs that equip nurses with the necessary skills and confidence to support kangaroo care. Another significant barrier is the time constraints and heavy workload nurses often face in the NICU. The high demands of caring for multiple critically ill infants can make it challenging for nurses to find the time to facilitate kangaroo care. Additionally, the perception that kangaroo care is time-consuming can further discourage its practice. To overcome this barrier, it's important to integrate kangaroo care into routine care practices and ensure that it is seen as a priority rather than an additional task. Nurses may also be concerned about kangaroo care's safety, particularly for very fragile or unstable infants. These concerns can stem from a fear of causing harm or discomfort to the infant during the transfer and positioning process. To address these concerns, it's essential to provide clear guidelines and protocols that outline the safe practice of kangaroo care. Regular training and simulations can help nurses become more comfortable and proficient in performing kangaroo care safely. Parents also face numerous barriers to practicing kangaroo care in the NICU. Understanding these challenges is crucial for providing the necessary support and encouragement to help parents overcome them. One of the most significant barriers is the fear of hurting the infant. Many parents, especially those with preterm or medically fragile infants, worry that their touch might cause harm or discomfort. This fear can be overwhelming and may prevent parents from engaging in kangaroo care. To address this, it's important to provide parents with clear, reassuring information about the safety and benefits of kangaroo care. Demonstrations and hands-on guidance can help parents feel more confident and comfortable. Another common barrier is a lack of knowledge about kangaroo care. Parents may not be aware of what kangaroo care is, how to perform it, or what its benefits are for their infant. This lack of information can lead to hesitation and uncertainty. To overcome this barrier, healthcare providers should offer comprehensive education about kangaroo care, including its purpose, techniques, and positive outcomes. Providing written materials, videos, and one-on-one instruction can be very helpful. The NICU environment can be highly stressful and anxiety-inducing for parents. The emotional toll of having a critically ill or preterm infant can make it difficult for parents to engage in kangaroo care. They may feel overwhelmed, exhausted, or emotionally drained. It's essential to offer emotional support and create a welcoming, non-judgmental environment to support parents in this situation. Encouraging parents to take small steps and gradually increase their involvement in kangaroo care can help them build confidence and reduce anxiety. Parental presence in the NICU is crucial for the well-being of both infants and parents. However, several barriers can limit the ability of parents to be present and actively involved in their infant's care. Some of those barriers include work and family responsibilities. Parents often have other responsibilities, such as work and caring for other children, making spending extended periods in the NICU challenging. Balancing these demands with the need to be present for their hospitalized infant can be overwhelming and stressful. Distance and transportation issues. The distance between the family's home and the hospital can be a significant barrier. Long travel times and transportation difficulties can limit the frequency and duration of parental visits. Providing support for transportation and accommodations can help mitigate this barrier. Financial constraints. The financial burden associated with having a baby in the NICU can be substantial. Costs related to transportation, accommodations, meals, and lost income from taking time off work can add up quickly. Financial stress can limit parents' ability to be present in the NICU as much as they want. Emotional and psychological stress. The emotional toll of having a critically ill or preterm infant can be overwhelming. Parents may experience high levels of stress, anxiety, and depression, which can affect their ability to be present and engaged in their infant's care. Additionally, some parents may avoid the NICU as a coping strategy because seeing their sick infant is distressing. This avoidance can further impact their involvement in the infant's care and bonding process. Providing emotional and psychological support is crucial to help parents cope with these challenges. Cultural differences and language barriers can affect communication between parents and healthcare providers. Parents who do not speak the same language as the medical staff may feel isolated and less able to participate in their infant's care. For example, the study by Brignoni Perez et al. Found that infants whose families communicated with clinical staff in a language other than English experienced reduced amounts, lower frequencies, and shorter durations of kangaroo care compared to infants from English-speaking families. This highlights the need for effective translation services and culturally sensitive practices to ensure equitable access to kangaroo care. Understanding the barriers that limit parental presence in the NICU is essential for enhancing family-centered care practices. Nurses and healthcare providers can create a more supportive and inclusive family environment by applying this knowledge. Recognizing the importance of parental presence, NICUs can implement more flexible visiting policies. Allowing parents to visit their infants at any time, rather than adhering to strict visiting hours, can help families spend more time with their babies and engage in practices like kangaroo care. Understanding that parents have other responsibilities, NICUs can offer support such as childcare services for siblings, flexible scheduling for kangaroo care sessions, and providing information about family leave policies. This support can help parents balance their commitments and be more present in the NICU. To address distance and transportation issues, NICUs can provide or arrange for transportation services, offer parking vouchers, and partner with local accommodations to provide affordable lodging for families. This assistance can make it easier for parents to visit their infants regularly. Recognizing the financial burden on families, NICUs can connect parents with financial assistance programs, social services, and community resources. Providing information about grants, subsidies, and other forms of support can help alleviate financial stress and enable parents to be more present. Enhancing the physical environment of the NICU by providing comfortable seating, private spaces for kangaroo care, and family-friendly facilities such as kitchens and rest areas can make it easier for parents to stay for extended periods. Creating a welcoming and comfortable environment encourages parental presence and involvement. Offering emotional and psychological support is crucial for helping parents cope with the stress of having a baby in the NICU. Providing access to counseling services, support groups, and mental health resources can help parents manage their anxiety and depression, enabling them to be more engaged in their infant's care. Addressing cultural and language barriers by providing translation services and culturally sensitive care can help ensure all families feel understood and supported. This approach fosters better communication and involvement from parents who may otherwise feel isolated. Continuous education and training are crucial for nurses to stay updated on the best practices and latest research related to kangaroo care. Regular training sessions, workshops, and seminars can help nurses develop the necessary skills and knowledge. Ongoing support from experienced colleagues and supervisors can also provide valuable guidance and reassurance. By investing in continuous professional development, we can ensure that nurses are well prepared to facilitate kangaroo care effectively. Training should include practical tips and techniques for performing kangaroo care safely. This can involve step-by-step demonstrations, hands-on practice, and simulations. Nurses should learn how to position the infant correctly, monitor the infant's vital signs during kangaroo care, and address potential complications. Clear protocols and guidelines can help standardize the practice and ensure consistency in care. It's important to create a supportive environment that encourages nurses to practice and promote kangaroo care. This can involve fostering a culture of teamwork and collaboration, where nurses feel comfortable asking questions and sharing their experiences. Encouraging open communication and providing positive feedback can help build confidence and motivation. Additionally, recognizing and celebrating successes in kangaroo care can reinforce its importance and encourage continued practice. Introducing kangaroo care to parents can sometimes face challenges that hinder their participation. Understanding and addressing barriers is crucial for parents to provide effective and beneficial kangaroo care for their infants. One of the most significant concerns parents have is the fear of hurting their infant. This fear is especially prevalent among parents of preterm or medically fragile infants. They worry that their touch might cause harm or discomfort to their baby. This fear can be overwhelming and may prevent parents from engaging in kangaroo care. To address this concern, it's important to provide parents with clear, reassuring information about the safety and benefits of kangaroo care. Demonstrations and hands-on guidance can help parents feel more confident and comfortable handling their infant.
I didn't know what I could safely do to care for my infant. It was overwhelming and I felt so helpless.
I was so scared to hold my baby because they looked so fragile and tiny. I didn't want to do anything that might cause them pain or discomfort.
The thought of moving my baby from the incubator to my chest was overwhelming. I was afraid that any wrong move could hurt them.
Uncertainty about their role in caregiving. Another common concern is uncertainty about their role in caregiving. Parents may feel unsure about what they can safely do to care for their infant and how to perform kangaroo care correctly. This lack of confidence can lead to hesitation and anxiety. To overcome this barrier, healthcare providers should offer comprehensive education about kangaroo care, including step-by-step instructions and practical tips. Providing opportunities for parents to practice kangaroo care under the supervision of experienced staff can also help build their confidence.
I didn't know what I could safely do to care for my infant. It was overwhelming and I felt so helpless.
Being in the NICU, I wasn't sure what I should or shouldn't do at first. I am like, they are mine, but are they? So it helped me feel more connected with my babies and more comfortable with caring for them when I was there.
I felt like I was just watching from the sidelines. I didn't know how to be involved in my baby's care without feeling like I was interfering.
Emotional stress and anxiety. The NICU environment can be highly stressful and anxiety-inducing for parents. The emotional toll of having a critically ill or preterm infant can make it difficult for parents to engage in kangaroo care. They may feel overwhelmed, exhausted, or emotionally drained. It's essential to offer emotional support and create a welcoming, non-judgmental environment to support parents in this situation. Encouraging parents to take small steps and gradually increase their involvement in kangaroo care can help them build confidence and reduce anxiety.
The NICU environment was so stressful. I was constantly worried about my baby's health and didn't feel confident enough to try kangaroo care.
I felt like I was not their mom without my babies at home, and this helped me feel closer to them. The emotional support from the nurses was incredible. They reassured me that I was doing the right thing for my baby, which gave me the confidence to continue with kangaroo care.
Addressing parents' informational, emotional, and environmental needs is essential for effectively supporting them in the NICU. Providing clear and consistent information. One key way to support parents is to provide clear and consistent information about kangaroo care. Parents need to understand what kangaroo care is, how to perform it, and the benefits it offers for their infant. This information should be communicated straightforwardly and reassuringly. Using various educational materials, such as brochures, videos, and hands-on demonstrations, can help ensure that parents receive and retain the information they need. Emotional support is crucial for parents in the NICU. Having a preterm or critically ill infant can be overwhelming and stressful. Providing emotional support and reassurance can help alleviate some of this stress. This can involve listening to parents' concerns, validating their feelings, and offering words of encouragement. Creating a supportive and non-judgmental environment where parents feel comfortable expressing their fears and anxieties is essential. The physical and emotional environment of the NICU plays a significant role in supporting parents. Ensuring that the NICU is welcoming and family-friendly can make a big difference. This can include providing comfortable seating for kangaroo care, ensuring privacy, and allowing flexible visiting hours. Additionally, involving parents in the care team and encouraging them to participate in daily care activities can help them feel more integrated and valued.
The emotional support from the nurses was incredible. They reassured me that I was doing the right thing for my baby, which gave me the confidence to continue with the kangaroo care. It was a way for me to bond with my baby and feel like I was actively contributing to their recovery. The nurses' encouragement and guidance were invaluable. I have 2-year-old twins who were in the NICU for quite some time, one for 6 weeks and the other for 7 weeks. I did provide kangaroo care for my twins, and I do believe it benefited them, but it also benefited me. I felt that I was not their mom without my babies at home, and this helped me feel closer to them. My nurses were very supportive of me doing kangaroo care. I probably wouldn't have known I could do it as they were in the NICU, all hooked up on different things.
Safety is a primary concern when implementing kangaroo care for infants with medical equipment. Studies have demonstrated that kangaroo care is feasible for infants with invasive lines or endotracheal tubes. The feasibility and safety of kangaroo care for infants, particularly those in the NICU with invasive lines or endotracheal tubes, is a valid concern. This table summarizes key studies that highlight the benefits and safety considerations of kangaroo care. The first study by Bisanali et al. Evaluated the feasibility and safety of kangaroo care in low birth weight infants on respiratory support. The study found that all infants completed the kangaroo care sessions without interruption, and there were no significant changes in vital signs or adverse events like accidental extubation. Arya et al. Conducted a large multi-center trial to assess the safety and efficacy of immediate kangaroo care in low birth weight infants. The study showed a significant reduction in mortality rates with immediate kangaroo care, and no adverse events were reported. Zia et al. Focused on the impact of kangaroo care on the duration of non-invasive ventilation and oxygen support in extremely low birth weight infants. The results indicated that kangaroo care significantly reduced the duration of respiratory support, demonstrating its safety and benefits. Kabir et al. Evaluated the feasibility and acceptability of kangaroo care in a national context. The study found that kangaroo care was effective in maintaining adequate temperature, reducing infections, and promoting weight gain, with estimates suggesting it could prevent up to 450,000 preterm deaths annually if universally implemented. And Nin assessed the acceptability of kangaroo care in a neonatal unit. The study found kangaroo care to be feasible and acceptable, with noted benefits in thermal care, infection reduction, and breastfeeding, despite challenges like inadequate human resources. Bosquet et al. Examined the safety of prolonged kangaroo care in very low birth weight infants. The study reported no significant adverse events, such as apnea or bradycardia, indicating that kangaroo care is safe for prolonged use. Bisanali et al. Evaluated the safety and efficacy of kangaroo care for neonates. The study involved 25 neonates and 60 kangaroo care sessions, with no adverse events reported, including line and tube dislodgements, and maintained physiological stability during kangaroo care. These studies collectively demonstrate that kangaroo care is both feasible and safe for infants in the NICU, including those with invasive lines or endotracheal tubes. By implementing kangaroo care with appropriate precautions and support, we can significantly improve the physiological stability, neurodevelopmental outcomes, and emotional well-being of these vulnerable infants and their parents. When implementing kangaroo care for infants in the NICU, especially those with invasive lines or endotracheal tubes, several safety considerations must be taken into account to ensure the well-being of both the infant and the parent. Continuous monitoring of vital signs, including heart rate, respiratory rate, and oxygen saturation, is essential during kangaroo care. Healthcare providers should be present to assist with the transfer and positioning of the infant to ensure that lines and tubes are not dislodged. Nurses and caregivers should receive specialized training on how to handle infants with invasive lines or endotracheal tubes during kangaroo care. Simulation training can help staff become more confident and skilled in managing these situations. Kangaroo wraps and other supportive devices can help maintain the infant's position and secure medical equipment. These devices provide ergonomic support for parents and reduce the risk of accidental dislodgement of lines or tubes. It is crucial to address the risk of dropping the infant during kangaroo care. Parents should be educated on proper holding techniques and the use of supportive devices to minimize this risk. Healthcare providers should be available to assist and ensure the infant is securely positioned. Nurses play a crucial role in ensuring the safety and effectiveness of kangaroo care for infants in the NICU. Here are the key responsibilities and actions nurses take to ensure infant safety during kangaroo care. Monitoring and support, continuous monitoring. Nurses continuously monitor the infant's vital signs, including heart rate, respiratory rate, and oxygen saturation during kangaroo care sessions. This helps detect any signs of distress or instability early. Temperature regulation. Nurses ensure that the infant's body temperature is maintained within a safe range. They use blankets and adjust the infant's position as needed to prevent thermal instability. Nurses assist with the safe transfer of the infant to and from the parent's chest, especially for infants with invasive lines or endotracheal tubes. This helps prevent accidental dislodgement of medical equipment. Secure positioning. Nurses ensure the infant is securely positioned on the parent's chest, using supportive devices like kangaroo care wraps to maintain stability and reduce the risk of falls or accidental drops. Nurses educate parents on the proper techniques for performing kangaroo care, including how to hold their infant safely and how to use supportive devices. This education helps parents feel more confident and competent in providing kangaroo care. Simulation training. Nurses may participate in simulation training to improve their skills in handling infants with medical equipment during kangaroo care. This training helps them become more confident and proficient in managing these situations. Nurses ensure that both the infant and the parent follow proper hygiene practices to reduce the risk of infections. This includes hand washing and cleaning the skin before kangaroo care sessions. Monitoring for infections. Nurses monitor the infant for any signs of infection, such as changes in temperature or behavior, and take appropriate measures if an infection is suspected. Nurses communicate and coordinate with other healthcare providers, such as respiratory therapists and physicians, to ensure that kangaroo care is performed safely and effectively. This interdisciplinary approach helps address any concerns and provides comprehensive care. Documentation. Nurses accurately document the infant's vital signs, observations during kangaroo care, and interventions. This documentation helps track the infant's response to kangaroo care and ensures continuity of care. Nurses are trained to intervene immediately if an infant shows signs of distress or instability during kangaroo care. They may reposition the infant, adjust medical equipment, or discontinue kangaroo care to stabilize the infant. Emergency protocols. Nurses follow established emergency protocols to manage any adverse events that may occur during kangaroo care, ensuring the infant's safety at all times. Nurses play a vital role in ensuring the safety and success of kangaroo care in the NICU. Through continuous monitoring, proper handling and positioning, education and training, infection control, communication, and emergency response. Nurses help provide a safe and supportive environment for infants and their parents during kangaroo care. Training is a cornerstone of effective healthcare, particularly in specialized practices such as kangaroo care. Training builds confidence and competence among nurses and standardizes practices, ensuring consistency and safety across the board. Building confidence and competence. Knowledge and skills. Comprehensive training programs equip nurses with the necessary knowledge and skills to perform kangaroo care safely. This includes understanding the physiological benefits, proper positioning techniques, and monitoring the infant's vital signs during kangaroo care. Confidence. Training helps build nurses' confidence in supporting and facilitating kangaroo care. Confident nurses are more likely to encourage and assist parents in practicing kangaroo care, ensuring it becomes a routine part of neonatal care. Standardizing practices, consistency. Training ensures that all staff members are on the same page regarding the procedures and protocols for kangaroo care. This consistency is crucial for maintaining high standards of care and ensuring that all infants and parents receive the same level of support. Safety protocols. Training includes clear guidelines and safety protocols that nurses must follow. This helps minimize the risk of complications and ensures that kangaroo care is performed safely and effectively. Ongoing professional development, continuous learning. Ongoing training and professional development opportunities keep nurses updated on the latest research and best practices related to kangaroo care. This continuous learning is essential for improving care quality and outcomes. Supportive environment. Training sessions foster a supportive environment where nurses can share experiences, ask questions, and learn from each other. Kangaroo care is vital in the NICU and offers significant benefits for infants and parents. It promotes better thermoregulation, enhances breastfeeding success, reduces infection rates, and supports neurodevelopmental outcomes for infants. For parents, it strengthens the emotional bond with their baby, boosts confidence in caregiving, and reduces stress and anxiety. Nurses play a crucial role in facilitating kangaroo care. Through comprehensive training and practical demonstrations, they gain the skills and confidence needed to support and guide parents. By providing clear information, emotional support, and a welcoming environment, nurses help parents overcome fears and uncertainties, empowering them to actively participate in their infant's care. The positive impact of kangaroo care on patient outcomes is profound. Infants experience improved health and development, while parents feel more connected and involved in their baby's journey. By embracing and promoting kangaroo care, we can enhance the overall experience for families in the NICU, leading to better health outcomes and stronger family bonds. This collaborative approach benefits the immediate well-being of infants and parents and sets the foundation for long-term positive health and emotional outcomes.